The gentleman from New York, Mr. Engel, 5 minutes for questions.
Thank you very much, Mr. Chairman, Madam Secretary. Welcome, and I too received a call from you, which I appreciated very much. I think it's just typical of your thoroughness and competency in the job you've done since you were appointed Secretary. And besides, my mother's name was Sylvia, so I had to like you from the beginning.
Thank you.
I want to just piggyback at first on a comment that Mr. Butterfield made, because it's something that's really been bothering me. I know that a lot of our friends on the other side of the aisle don't like the Affordable Care Act, and we voted 62 or 63 times to repeal it, which I think is a waste of time. You know, any major bills of this substance in the past have always been tweaked once the bill comes out and you see what works, what doesn't work. Nothing's going to work 100%. And so if a bill is not doing everything we wanted it to do, we could make some legislative changes, and that's really the way to do it, not try to repeal it. But our friends on the other side of the aisle refuse to do that. And what also is frustrating is, again, when governors are refusing to expand the Medicaid program. You know, my mother, Sylvia, used to have this expression that, you know, don't cut off your nose to spite your face. And that's exactly what the Republican governors are doing, that have refused to expand, you know, the Medicaid program to really help the citizens of their states. So I'm wondering if you could comment on anything I've just said.
So, you know, as we've spoken about a number of times in this hearing, I think it is so important to make that progress in terms of the coverage, in terms of the benefits that we can see through expansion. And we see that both for individuals, and I've had the chance to meet those individuals as I've traveled across the country, in terms of what it means for them, whether it was someone being diagnosed with cancer and actually catching the cancer and being able to treat it in terms of an extreme situation, or just the security of knowing that they have the coverage and can do prevention as well. But I think the economics are also equally important. That's about the individual, and that's important. But the economic issues in terms of hospital closures, in terms of uncompensated care, in terms of people's ability to pay their bills, are all things that are important consequences that we believe other states are already seeing the benefits from, and we'd like to see the rest of the states, and as I've said before, willing to work with any state on the approach that they think's right with them. Just want to make sure we meet the standards that you all have given to us statutorily, which is making sure that affordable care is available.
Thank you. I'd like to ask you a few questions involving Puerto Rico, because you had mentioned Puerto Rico before. You mentioned it in your submitted testimony. Mm-hmm. Could you please describe the current economic situation there and how it's negatively affected the health care system there?
The economic situation is dire, and certainly my colleague at the Treasury Department, Mr. Liu, has taken the lead in terms of both our talking about that issue as well as working with the Congress on fundamental issues that we think will make a difference to getting to a different place economically. But the healthcare issues are very closely intertwined, and so the issues of legislation to help in terms of a way forward on the economics are very intertwined. The success of that is intertwined with healthcare, and it is because traditionally payments have not been equitable. And we talked about that, touched on that a little bit earlier in one of the questions in terms of the payments on the Medicaid side. And what that does is it leads to a number of things. Obviously, it leads to coverage issues in terms of what kind of coverage people get. It also leads to provider issues because providers aren't paid. And what we've proposed in our budget is a proposal that over time would bring the payments in Medicaid to a more equitable space and at the same time require reforms in terms of meeting certain standards of the performance of the Medicaid program. So we think that we have a proposal before the Congress that can complement in an extremely important way. And I think right now with Zika, you know, the numbers continue to rise. Today, this morning, I got my briefing, 111 cases, you know, and in terms of the U.S. And in Puerto Rico right now, they are being spread by the mosquito there. And we know the penetration of both dengue and chikungunya in Puerto Rico. And so this health issue, if those children, if pregnant women get Zika and have children with microcephaly, the cost is between $1 million and $10 million per child.
So it's really fair to say the situation in Puerto Rico is both an economic crisis and a health care crisis. That's for sure.
It is fair.
And the President's laid out what I think is a very reasonable approach to addressing the issues at hand, and I hope this committee will give the President's proposal serious consideration. I want to ask you about your testimony. You described several steps the President has proposed to address the Puerto Rican crisis. Can you elaborate on his plan and what it does and how it aims to solve the problem?
So I think the changes in Medicaid are the place where we have the most important proposal. It would do the changes over a period of time in terms of that payment. It would change the cap as well as change the payment matches over the period of time at the same time that reforms are required.
And then my last question is, wouldn't you agree that Puerto Rico is a prime example of the tremendous risk we would face if Medicaid moved to a block grant system because of Puerto Rico's financing design? It's really not equipped with the flexibility it needs to adapt to financial downturns.
Yes, which is why you see monies in the supplemental proposal that you'll be reviewing from us is a part of, yes, is the answer, and that's part of why you'll see funding in the SUP, because now they have a crisis in Zika.
Thank you, Mr. Chairman.
Chair, thanks, gentlemen. Now I recognize the gentleman from Virginia, Mr. Griffith, 5 minutes for question.